This PowerPoint is going to walk us through most of Chapter 4. Perhaps one of the most beneficial aspects of working in sleep is the autonomy enjoyed by the sleep tech. He or she is generally expected to work independently and make decisions based on patient care. You typically have protocols you can follow which provide you boundaries in the decisions you make, which most people find very helpful. The major downside for sleep technicians is that we work while others sleep, and we sleep while others work and play. This can be challenging both mentally and physically. It's the responsibility of the tech to ensure that he or she practices good sleep hygiene and gets enough quality sleep in order to fully function during the night shift. You have to keep in mind that sleeping during the day, you're going to get less sleep as compared to if you were sleeping during the night. That's just natural bodily functions with the circadian rhythm. So you want to make the most of the sleep you do get and ensure you're getting good consolidated sleep. You owe it to your patients to be in the top performance mode. Registry, or the RPSGT credential, is preferred, but is currently not required in most states. The duties of an RPSGT is to perform nighttime studies. Many sleep labs use 12-hour shifts, some use 10-hour shifts, where the patient usually arrives in the lab somewhere between 8 p.m. and 9 p.m. and they leave around 7 a.m. Some sleep labs strictly schedule their patients around the patient's sleep schedule, so you could be arriving at the lab as early as 6 or 7. Other sleep labs sometimes have set entry times to the lab, so you might just be dependent on that. The AASM recommends a patient-to-tech ratio of 2 to 1. However, a ratio of 1 to 1 is warranted for difficult or unstable patients. Sleep technicians or technologists are allied health professionals who work under the supervision of a licensed physician to assist in the education, evaluation, treatment, and follow-up of patients with sleep disorders. The scope of practice includes analyzing, monitoring, and recording physiological data during sleep and wakefulness. Duties fall under 6 general categories: instrumentation, performance of polysomnography, professional education, patient care and education, communication, and additional tasks. You can find all of these located on the AAST website, which includes not only your scope of practice, but also the competencies for sleep technicians and technologists. You should maintain professionalism at all times. What does that mean? Dress and act like a healthcare professional. Most sleep labs require you to wear casual professional attire or scrubs. Always introduce yourself before approaching the patient. Protect the patient's privacy and dignity. Always allow the patient to ask questions. Educate the patient as to all the aspects of the test before you begin the hookup, including an orientation to their environment, education about the audio-video recording, electrode placements, etc. Being a professional also includes maintaining your credentials. So how do sleep techs go about this? Well, it's going to depend on which credentials you have. If you have the gold standard credential, which is the RPSGT, then once you earn that credential by taking the RPSGT exam, you then maintain it by accruing 50 CEUs, that's continuing education units or credits, every 5 years. Infection control. Universal precautions is now widely practiced by healthcare personnel. In 1987, recommendations were made by the CDC, that's the Centers for Disease, that blood and body fluid precautions be consistently used for all patients. Therefore, blood and bodily fluids of all patients are considered potentially infectious. This means any time that you have the risk of coming in contact with blood or bodily fluids, you should wear gloves. You also want to make sure you wash your hands before coming in contact with anyone and after removing gloves or after becoming exposed to anything. In addition to universal precautions, other types of infection control include hand washing, gloves, equipment cleaning, disposable when appropriate. So if it's a disposable piece of equipment, throw away. If it's non-disposable, make sure you disinfect it. Linen cleaning and storage. You should never clean you should never store dirty linens with clean linens. They should always have a separate storage area. And then lab cleaning. HIPAA, the Health Insurance Portability and Accountability Act. This was created in 1996. The goal was to assure that patients' health information was protected while allowing the flow of information for quality health care. This applies to health plans, healthcare clearinghouses, and to any healthcare provider, no matter the size, who transmits health information in electronic form. So what information is protected? Any information that can identify the individual. So individually identifiable health information held or transmitted by a covered entity or its business associate in any form or media, whether electronic, paper, or oral. The privacy rule calls this information Protected Health Information, or PHI. Individually identifiable health information is information including demographic data that relates to the individual's past, present, or future physical or mental health condition, the provision of health care to the individual, or the past, present, or future payment for the provision of health care to the individual, and that identifies the individual or for which there is a reasonable basis to believe can be used to identify the individual. Individually identifiable health information includes many common identifiers, which includes their name, their address, birth date, social security number. Quality control initiatives measure and assess the lab's self-assigned level of excellence. A variety of quality control measures can be implemented to monitor any of the following. Technician accuracy, this could be on recording and or scoring. Patient satisfaction. Office personnel accuracy, this could include reporting and scheduling. Sleep lab operations, this could include cleanliness, room temperatures, equipment inventory, etc. One of the requirements of accreditation is that you have quality control measurement initiatives in place. It is the preferred goal of many labs and medical directors to encourage their technicians to obtain the Registry in Sleep, or the RPSGT credential. Successfully obtaining the RPSGT ensures that sleep technician has successfully passed specific knowledge requirements pertaining to sleep medicine. However, once the technician obtains the RPSGT, the learning does not stop. The RPSGT credential ensures basic competency, so it is a very low level of learning that you are demonstrating by passing this credential. The BRPT, which is the credentialing body for the RPSGT, that is a misprint here, it's not a licensing body, it's a credentialing body, now mandates that a minimum number of continuing education units be acquired before recertification can occur, and they require 5 credits each year. So what credentials can be obtained for a sleep technologist? Well, from the BRPT, you can get the CPSGT, that's a Certified Polysomnographic Technologist. That is only good for like 1 year. I highly suggest that you do not spend your money on that credential. The RPSGT, or the Registered Polysomnographic Technologist credential, this program specifically trains you to pass that exam because that is the gold standard and the most desired credential by sleep labs. Accreditation requires sleep labs to have 1 RPSGT on staff. So this is what most sleep labs look for when they're hiring a sleep tech. The CCSH, or the Certification in Clinical Sleep Health, by completing this program, you should be able to pass this exam as well. We cover a lot of this information, or you at least will have the resources to be able to pass this exam by the time you complete this program. This is a higher level than the RPSGT, and this involves more with managing patient care. Then there's the Clinical Sleep Educator, the CSE. That is more a designation than a credential. From the ABSM, American Board of Sleep Medicine, they provide the RST credential. Some people find this to be equivalent to the RPSGT, but not everybody agrees on that. What makes you eligible to become a certified or registered as a sleep technologist? Well, again, it depends on which credential you want. but in order to be eligible to get the gold standard, which is the RPSGT, there are 6 different eligibility pathways. You are all entering or going to be able to be eligible for the RPSGT by pathway 3. And if you look that's in the middle of your screen, and that's because you're attending a KHEP accredited educational program. That's the program you're currently enrolled in. So once you graduate from this program or complete this program, you will be eligible to take the RPSGT exam right away. The other pathways include pathway 1, which is clinical experience, and this is for someone who's had over 1,600 hours of experience in the field, and then they also have to complete this self-study education program through this STAR program. So it's like an online module. Pathway 2, this is for candidates who already have a healthcare credential and have worked a minimum of 546 hours in a sleep center. The next way is pathway 4, and this is for someone who has had a minimum of 819 hours of experience in the field and who have also completed a combination of the STAR designated education program. And then there's 5, and that's for international people, so that doesn't apply to us. And then pathway 6 is if you were an RPSGT and you let your credential expire. So you all will be entering through pathway 3. The professional organization which supports sleep technologists is the AAST, and I have given you an assignment for this week for you to review the website on that. Take your time and peruse it. You have a quick questionnaire to answer about it. Really, this is the society set up to support you. It provides you educational opportunities. It has some resources for you to pass your RPSGT exam. Student membership is $50. When you graduate from the program, it's $125 annually. It's a great opportunity if you want to get involved in sleep to volunteer. They also have a job board, so it posts jobs nationally, as well as a blog. So it's a great source of information for you entering the career. If you were to briefly describe what you do as a sleep tech, which really encapsulates your expertise, how would you describe your profession? Well, for those of you first entering, that might be a very hard question for you to answer, so I've kind of given you the answer for this. This is what you're shooting for, okay? You're going to be an expert at acquiring reliable and accurate sleep and wakefulness data, which sleep physicians use to make a diagnosis and treat. I am also an expert at fitting, titrating, and troubleshooting PAP devices to eliminate sleep-disordered breathing and improve quality of life. I also educate patients on practices that promote sleep and those which they should avoid because they inhibit sleep or exacerbate sleep disorders. So for the next 6 months, these are what you're shooting for. These are the skills you're trying to acquire. So what would I do on a nightly basis when working as a sleep technologist? Well, the first thing you're going to do is prepare the sleep center for patient arrival. This includes reviewing their file, making sure it's complete, looking over their history so you understand what type of patient is coming into the lab, setting up all your equipment so it's ready to be used when the patient arrives, entering all the demographic data into the sleep system, and so on. The next, you're going to introduce the patient to the sleep center and orient them to their environment. Next, you're going to hook up the patient and prepare for either their diagnostic or therapeutic test. You want to always educate on the procedure that's being performed, PAP therapy in case you need to start it in the middle of the night, good sleep hygiene practices, and the process of being evaluated for and treated for sleep disorders. You also want to educate on sleep apnea and how PAP therapy treats it and expected outcomes of not treating their sleep apnea. You also want to promote patient self-management, including how they can help themselves improve their sleep and address any other sleep issues they might have. In other situations, you might be performing another type of diagnostic or therapeutic testing. It could be the MSLT, MWT, and others, and so you'd want to provide the correct education for that as well. Another duty would be scoring the diagnostic and therapeutic test for the physician to interpret. And then finally, in the morning, you're going to unhook the patient, remind them of the follow-up procedures and what they can expect. Adhering to these practices professionalism, HIPAA, infection control, quality control, and education often separates the true professionals from those that fall below the bar. Good practices will strengthen the physician's and the patient's trust in you. Again, your goal is to learn as much as you can and develop as excellent skills as you can in the next 6 months.